other ways.
Explain it better to the patients. What else? How else do you help the doctors?
We can also insure insurance coverage. So that's a big one. We want to foster a healthy, trusting relationship between the patient and the doctor. I mean, that really helps with patient adherence to, treatment and that kind of thing, is that building this relationship between the doctor and the patient. And when you don't have insurance coverage, proper insurance coverage, then, you get this rift between the patient and the doctor. They go to an appointment, they're not covered by insurance for whatever reason, and it's something simple like, they have the wrong phone number or they have the wrong address. And then insurance just denies it, and the patient has no idea why. Therefore, they're charged the full amount. They think the doctor's trying to, pull something on them, and they, therefore, don't go back to the doctor. So, patient advocate can do things like help with insurance denials and medical billing. So
I could have used you a couple of years ago because, as I mentioned, I'm with Kaiser, so I have to stay with Kaiser. But for some reason, something screwy happened in their billing, and they said, okay, for a certain thing, you can go outside. And I had to go see a specialist about something. I confirmed it 47 times. This health reporter knows how to check and double check. Did I have permission from Kaiser? Had they contacted the other hospital? Was it confirmed at the doctor's office? Is everything okay? Seemed to be fine. I get in with no problem. I have my 20-minute appointment. Fine, nice and comfy. About the end of the month, suddenly I get a bill from the outside hospital for $200 and something, which technically I don't owe. And you should have seen the fighting this bill. And if I hadn't been a reporter and gone to the corporate communications office and say, can somebody fix this already, it is very difficult. And that's why God bless people like you.
Yes, and for the average person, they don't even know where to start with insurance. So, they don't even know you can just call and usually fix it. I mean, it's a lot of insurance denials are something really simple, that it's just, a numerical error or something silly, a clerical error. So, that's one of the things we do.
I mean, it will get you totally crazed, especially if you are an educated patient. Here we are doing all this work, whether it's advocates like you, the hospitals themselves, the insurance companies, reporters and writers like me. We're gathered together. We are finally truly trying to do real patient help. But we're so mixed up in so many ways. This insurance company doesn't do it this way, and that hospital does it a different way, and Lord, keeping track of this and helping people, no wonder we need patient advocates.
Right, and, a lot of times it just, I get bills that just weren't even run through insurance at all. It'll say, the person wasn't even covered by insurance, and they'll have, this $1,000 bill, and people hand me the bill and say, can you help me with this? And I'll just look at it and say, you know what, this actually wasn't even run through your insurance at all, so why don't we do that first? So that happens a lot. I mean, it's silly things like that. So, it helps to have somebody that just knows how to look at a bill and kind of tell what's going on.
Yeah, and it's not silly. It's heartbreaking. It's wrenching because even if, thank God, the issue's been cured or taken care of, so you're on medication or you've had your knee surgery or whatever, and it's done, and you'll be recovering, that's hard enough to get the top guide stuff going on. But if it's something chronic and especially terrible, it's bad enough if you have, I'm nearsighted. It's never going away,
Yeah, exactly.
So even with certain eye surgery, it's not going away. Okay, that you can live with. But if it's something truly debilitating and it's tearing your life apart, and it may not be you yourself, it could be a child, it could be your spouse that's in trouble. And you're the caregiver, and I've written on caregiving almost since I started my specialty of writing for and about older adults and an aging population. And we don't report enough on the caregiver stress. And so if you add in the gosh darn bills, which, please God help us, at least they started writing our prescription information correctly, in lay language. But the bills, even I have trouble. And as I say, I'm a health reporter.
Oh, yeah, those hospital bills, the itemized bills, those are crazy.
Yeah.
That's what we ask for when we're trying to look at those hospital bills. They are a lot of medical terminology, and a normal person would not be able to read those and be able to, determine what exactly is going on those. So that's another good reason to hire a patient advocate is to look at those hospital bills and be able to tell if they're correct.
How do they hire a patient advocate? Is it word of mouth? I mean, yes, you have a website, and a lot of them do have websites, although I will warn people not everybody has a website, even in the 21st century, and not all of them are good websites. They, people try and do it themselves, and trust me, I've been doing web work for 20-something years. It's not easy to get done.
Yeah.
So how do we find the person that we really feel can help us?
So mine is basically just from Googling patient advocate or health advocate. My marketing is next to nothing, basically. I kind of started just from the ground up, and I basically just been working out of my home. And I really have gotten a lot of business just from having a website and also going through Advo Connection, so the Alliance of Health Advocates. So that has helped me a lot. Advo Connection is a way that you can find patient advocates. So you actually just put in, what you need, and then your zip code and however many miles you want. But basically, a lot of us, we can do what we need to do on the phone or on the internet. So most of my clients, I've never actually met in person. We do everything over the phone. So,
how do they get you copies of their bills and all that kind of thing?
So they can scan and email them to me. We don't really use fax, but they can even take a picture on their phone. I mean, it's really, really pretty easy these days. As far as what I need is really just a picture of the bill. I have documents that they fill out, like a HIPAA form. So when I need to call the hospital,
if we sneeze, we fill out a HIPAA form. Okay.
Yeah. So they fill out HIPAA forms and they fill out other documents, and that way that lets me get into their business, and I'm able to negotiate with the hospital or figure out the bills and talk to the billing department. Also, the insurance company likes those HIPAA forms, and the doctor's offices and that kind of thing. So, but yeah, most of it is just over the internet. It is having a website that's helped me.
Well, that's wonderful. Yeah, a website, when it's done right, and a little networking and so forth. I teach people what helps increase business and how, from the business side, and also taught to the consumers, the patients. And in fact, I found 2 resources instantly when I just typed in patient advocacy or patient advocate online, and I found the Patient Advocate Foundation, and I looked it up, and they have lots of great info. You do have to be careful who you double check, because somebody sent me an email, I clicked on it once, and I said, I'm not attaching anything to this group, But I looked up Patient Advocate Foundation, and they have lots of great information, links to more information, ways to connect with various services. And so I would suggest that listeners, and again, because I'm talking not just to the patients and the consumers, I'm talking on the business side, and the doctors and nurses and others who are providers need to check out patient advocates more. So this is patientadvocates.org. And then I also found one that specifically links people to different cancer organizations, and they have, on those organizations, they have information for cancer patients and families. Now, this is a little screwier as far as the link goes, so people listen carefully, and I'll repeat it. It's called ACCC, so that's A and 3 C's, -cancer.org. ACCC-cancer.org. I have no idea what it stands for. It brings you to the Oncology Society in Hawaii, but it does offer very legitimate links, so I'm going to repeat it one more time. To find certain specialists in cancer patients and perhaps advocacy, it's ACCC-cancer.org. And you've given some great resources Candace?
Yes, in mine, I actually said it wrong. It's the Alliance of Professional Health Advocates.
The Alliance of Professional Health Advocates. Okay.
Yes, APHA.
And do you have their website in front of you, or people will just look it up?
It's APHA, A-P-H-A.
.org?
Yes.
Great. apha.org, the Alliance for Professional Health Advocates. And, you know, folks, look up your condition. Even when they're rare disorders, there are a lot of patient advocacy groups out there. I was at a conference on patient advocacy in D.C. late last year, and it's amazing. Yes, I ran into, I forget, the American Cancer Society and certain pharmaceutical companies, but I also found a number, besides the organization for rare diseases, rare disorders, it's NORD, that I remember. They talk about conditions that are very, very rare. And besides that specific organization, I found people from other groups that are specific to very rare conditions. So look them up online. People double-check them, as Candace and I both told you to. Don't just, hop onto anything, because there are websites from, whoosywhatsy.com telling you not to give your kids certain shots, and be very careful of who you look up, okay? So, that's bringing us right towards the end of the show. Candace, any last-minute advice? Otherwise, I'll just ask you to remind people who you are and where they can find you.
Just remember your patient rights. You have the ability to make your own decisions, to accept and refuse treatment, and to ask questions and have your questions answered thoroughly. And until you get those questions answered, don't make a decision.
Yeah.
And always find a second opinion.
But try and stay calm, and that's another good reason to have somebody near you who can keep calm and say, well, wait a second, we didn't understand this. Explain it better.
Yes.
That's great.
Well, thank you, Wendy.
Well, thank you. I am thanking my guest, Candace Wenham. And Candace, remind folks of your business name and how they can reach you.
My business is Advocate ATX, and I'm located in Austin, Texas. And my services can be done from anywhere. So please give me a call. It's 512-967-3363.
Okay, repeat
Thank
it one
you so
last
much.
time.
It's 512-967-3363.
Okay, so I want to remind folks again to tune in next week at 9 a.m. for my partner Gail Dixon and her next wellness topic. And, of course, don't forget to keep checking us out on Facebook, Twitter, LinkedIn. We tend to repeat these episodes on Spreaker.com, and it's Spreaker, not Speaker. There's an R in there. Spreaker.com early in each coming week after the show. As I mentioned earlier, for questions about advertising in 2019, questions in advertising in 2019, or even being a guest, you can contact me at wendyjm.pih@gmail.com, and there's our website to check out, which we are redoing, by the way, but it is partnersinhealth.biz for now. And my main website is WMMedcom, MEDCOMM, like medical communications, WMMedcom.com, where you'll find my contact info there, and we can look forward to the second quarter in health communications for print and online, business-to-business and business-to-consumer work. So again, I am Wendy Myeroff. I thank Candace Wenham for talking about patient advocacy. She's in Austin, Texas. From Partners in Health and Biz, enjoy your weekend.